You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible.
All right, folks. Now, there's a new COVID variant that is causing significant problems all across the country, which means you've got to stay vigilant. The White House is trying their best to warn people of that. Joining us right now is Dr. Ebony Hilton. Of course, she's been on the show many times with the University of Virginia, anesthesiologist. Glad to have her back as she is trying to get her Twitter account verified as best as possible. And so I'm trying to help her out, y'all. She was sort of complaining earlier, and she mentioned all of these media outlets she's been on: CBS, NPR, and USA Today. And I'm kind of like, well, you might get your check mark if you mention you would Roland Martin Unfiltered. But I'm just saying.
I did say your name is right. You know what? And see, this is why y'all see how he does me every single time. How are you, Roland?
I'm fine. I'm fine.
You look like you're tanned. You been out? You been out? You look like you're tanned.
Well, you know, I'm not afraid of the heat like you are. Yeah. If y'all follow her Twitter feed, y'all know what I'm talking about. She's afraid to get a little toasty. All right.
When I say it was hot, it was hot as Hades outside. I tried to go outside and work out. I almost passed out.
You done?
Yes.
All right. Let's talk about this COVID variant. Stuff is opening up. Folks are running around. They think the world is just wide open. And you keep saying, man, y'all better settle the hell down and stay vigilant. What's up?
Settle down. I mean, so we know where were you to start? The CDC changed our mask guidance it seems like a month and a half ago now. And I said immediately, I think this is very premature. One, because they were basing it on data, real life data, that was largely based on what was happening in Israel. And what we know is that Israel, by April the 3rd or 4th, had over 60% of their entire population vaccinated. We still aren't to 60% today. And even with them getting that to April the 3rd or 4th, they didn't lift their mask mandate until April the 18th. They still said we still need to be vigilant and get as many people as possible vaccinated before we say, okay, maybe we can take off our mask. And guess who's now stepping back on that? Well, those very same countries, because of the Delta variant. The Delta variant, if we go back, we had the UK variant, that's the Alpha variant. We had the Beta. That's a South African. We had the Gamma, that's down in actually in South America. And now we have the Delta variant. And the difference between the UK variant and Delta variant is that the Delta variant can actually evade the immune system, meaning that it makes our vaccines, although yes, our vaccines are still effective in keeping you most likely alive, that we're seeing more people actually get sick though. And to give an example, I have a friend who received her last dose of Pfizer vaccine on February 12th. Her husband actually was fully vaccinated back in January because he's a healthcare worker. And she traveled for work and unfortunately picked up COVID-19, likely on an airplane going to Atlanta, Georgia, but picked up COVID-19 the first week of June. And she presented with chest pain that she had to go to the emergency department because she was in such discomfort, loss of taste, loss of smell, and she infected her husband. 5 days later, he started to have symptoms, and now he has achy joints, and both of them had COVID positive tests. So this is not just symptoms, but this is literally confirmed testing. So we cannot lose our guard or think that we have control over this thing yet. The virus is continuously trying to outsmart us, and we have to be 2 steps ahead, which means until our numbers are down, until we see our cases literally go down to 0, like they do in New Zealand, right? We got to keep our masks, wash your hands, don't go into these large crowds, to these concerts that I'm seeing pop up everywhere. We're going to really go into this fall in a very precarious situation. So, yeah.
Okay, so if we've been vaccinated, but we've been told, hey, you can take your mask off. You don't have to do these things. So what the hell? Now, granted, a lot of airlines, I've flown in the last 8 days to New York, to LA, Chicago. The airlines to require you to wear your mask. But I can tell you, Ebony, it was a lot of folks rolling up on me in Chicago, no mask, LA, no mask. Folks are having events. Very few people are walking around with masks. I don't see folks with a Perel or they hand sanitizer.
Mm-hmm. Yeah,
that's what's happening.
And what we're seeing is that although, again, people have to realize what we report nationally as far as numbers can mean absolutely nothing in your neighborhood, because what we're seeing, U.S. cases, yes, they're down, but they're up by 68% in Oklahoma, up by 45% in Missouri, 42% in Arizona. And it's all because if you're looking at where vaccine uptake is higher, we're seeing that those cases are staying pretty well in the Northeast, doing pretty well. But down south, where you're struggling to get people vaccinated in Alabama, for instance, we're seeing the COVID cases number go up. And then what I urge the CDC and the World Health Organization to do is to be transparent, to say, yes, vaccines do a fantastic job at keeping you alive, but that is not the only consequence of COVID-19. We know there are many people who have survived COVID-19 who now can have difficulty walking a full block around the neighborhood, and they're 30, 40 years old. They should be able to do that. We have people who have survived COVID-19 who now have COVID brain, where they can't hold a string of thoughts. So they have basically a severe form of just attention deficit. And that's one of my friends. She has now word finding difficulties. We have people who are survivors of COVID-19 who now have chronic pain issues. Their back and their joints are hurting. That's where her husband now has. And it's only been for 3 weeks. And I'm hoping that will subside and that their symptoms will get a little bit better. But it's been 3 weeks of them having chest pain. It's been 3 weeks of them having joint pains. And the thought is, when will this end? I have another mentee. She's in her 20s. She was infected with COVID-19 in January, and she still to this day cannot taste or smell. Now, what does that mean when we now have studies out of Stanford that shows that people who have died from COVID-19, who weren't necessarily coming into the hospital because of neurologic deficits, but when they did an autopsy, their brains are resembling those of persons with Alzheimer's and Parkinson's disease. And I talked to you about this last year. Before we had studies to show it, my question was, what are the long-term consequences of people who say, I lost my taste and smell? That means that it affected your brain cells. There has to be something that's linked to that. And so it's just simply not worth the risk of going to a concert without a mask on and having fun for 2 hours if it means for the rest of your life you're going to have this string of impairment. So,
All right, then. Well, Dr. Ebony Hilton, it's always great to have you on the show. When you headed back to Charleston, South Carolina?
Next month.
Next month. Well,
let's stop consulting so we can help save the world. No, I'm just joking. Yeah, I have a business meeting. So.
All right. Well, I'm going to be actually there, I think July 8th through the 11th. So I'm going to,
golfing?
Yeah, I'll be teeing up with my man Darius Rucker. So we're going to hit a little golf. So
I just want to know if Reese, did Black Women Views, we're going to be on Twitter to ask about, were we invited to this? We've been promised resorts. We've been promised.
No. Hold on. Let me correct something. You have not been promised. You have suggested that I somehow, somewhere, someday, in real life, which I think is imaginary, said I was going to give y'all all expense paid a respite at a resort. But you clearly had an edible.
No, I don't do no, sir. Do a hands down. I don't do drugs, but what I do is show up, and I will show up on a golf course, and we will have this resort. So I thank you in advance, and may God bless you.
Y'all love throwing God in there. All right, Ebony, I appreciate it. Thanks a lot.
Thank y'all. Y'all have a good one.
Back to our Roland Martin Unfiltered video in just one moment.
Racial injustice is a scourge on this nation, and the Black community has felt it for generations. We have an obligation to do something about it. Whether it's canceling student debt, increasing the minimum wage, or investing in Black-owned businesses, the Black community deserves so much better. I'm Nina Turner, and I'm running for Congress to do something about it.
You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible.
All right, my first guest loves to say, listen. Y'all better listen, in her Charleston, South Carolina accent. I'm talking about Dr. Ebony Hilton. She's been a frequent guest on the show. Go ahead and pull up. Listen.
Well, they should have listened. If they did listen, we wouldn't be in this mess that we're in right now. So there's that.
So y'all, Dr. Ebony Hilton, she of course, from University of Virginia, also with Good Stock Consulting out of South Carolina. She has been constantly upset with these folks when it comes to COVID, not want to put their damn mask on, folk getting upset about the vaccine. Ebony got one of them space age masks that she wears when she's in the hospital, wear it for 13, 14, 15 hours a day. She don't even take it off to eat, y'all. She ain't taking it off. Nope. And so you got the Delta variant that, of course, is happening all across the country. Now you have the Lambda variant is causing many conversations about vaccines and mask mandates. Here are the COVID numbers as of today. In the U.S., 35,019,526 reported cases of COVID-19 and 624,998 reported deaths. Now, we are seeing increases happening in a variety of states. Now, the White House, they've also reached out to Fox News regarding their controversial COVID coverage, often disputed by Tucker Carlson, Sean Hannity, Laura Ingraham, and others. This is former Fox White House correspondent Carl Cameron talking about the spread of misinformation by folks like Tucker Carlson.
It's about ratings.
Just money.
And ratings ultimately become revenue. And that's the name of the game. Whoever gets the most clicks on social media makes the most money, gets the most fame, gets the most attention. And that type of activity is not journalism. It's not news. It's gaslighting. It's propaganda. I mean, just last week, new infections went up 70%. And according to the CDC, the NIH, which oversees the CDC, it is absolutely 99.5% of those infections are people who haven't gotten vaccinated. I mean, come on. Anybody who disputes that sort of stuff is putting people's lives at risk and potentially killing them.
Then, of course, last night you had all of a sudden Sean Hannity with a different tone. I'm just curious, are they going to get sued or something? Because normally, you know, when they decide to change their tone, things are result of a lawsuit. Y'all, here is the blabbermouth himself last night. Listen.
Just like we've been saying, please take COVID seriously. I can't say it enough. Enough people have died. We don't need any more deaths. Research like crazy. Talk to your doctor, your doctors, medical professionals you trust based on your unique medical history, your current medical condition, and you and your doctor make a very important decision for your own safety. Take it seriously. You also have a right to medical privacy. Doctor-patient confidentiality is also important, and it absolutely makes sense for many Americans to get vaccinated. I believe in science. I believe in the science of vaccination. Just like we've been saying.
Now, it's a whole bunch of folks on Fox News. Oh, not y'all. They got their vaccines. Remember when they were complaining about the vaccine passports? You do know at Fox News they have to require that to even come into their building. But just so you understand the game that's Carl Cameron, y'all, he spent years at Fox News is playing. Check this out. I saw this where I was coming in and, you just heard Sean Hannity there on Fox News. This is Media Matters. Sean Hannity tells his radio caller he was correct to ignore his doctor and refuse the COVID vaccine. See, y'all need to understand the games being played. See, this is why we're dealing with the Delta variant and cases are increasing in Texas and California, because all these idiots who keep listening to people like Sean Hannity and Tucker Carlson. When you heard President Joe Biden say Facebook is killing people because they allow misinformation, their algorithm, folks, drives revenue. And when you have these conservative people on the right, like Ben Shapiro and others, Dan Bongino with the top numbers on Facebook, they're spreading misinformation. That, Ebony, is the problem. They literally are listening to these idiots as if they're giving them great information.
Right, and it's ridiculous considering the fact that you don't have to. I don't know the saying. You don't have to see a duck to know it's a duck. Like if you can hear it quack. We've been now in this pandemic for a year and a half. We shouldn't have to tell people that water is wet and that COVID is dangerous. But yet here we are, and what we're seeing across the nation. We have an increase in 198% in our COVID cases over the last 2 weeks. And if you think about the last 2 weeks, that means January the 4th, where everyone was partying. That's where we're seeing these numbers right now. So 198% increase in new cases, 45% in hospitalizations, 45% in death, even though our testing is down 13%. So imagine that. We're not testing as much as we were 2 weeks ago, and yet our counts are going up, which is a bad sign. And if you're looking at it across the board, Mississippi has had an increase in over 308%. If we're looking at Arkansas, we're talking about 120%. Alabama, you can go literally across the board. You're looking at 300% increase in your new cases. And I hate to say it for Mississippi, with this 300% increase, you don't have the hospital density that they do in New York City, that they do in California. You don't have the infrastructure in place. So all those persons that are getting infected, the likelihood of you dying increases because the resources there to keep you alive are simply not there. So
and what happened was, Ebony, we had these people who we got to open up, and they were putting pressure. There was pressure on the Biden administration to do so. They lifted the mask mandate, and folk just lost their damn mind. I mean, the moment the mask mandate was lifted, folk just lost their mind. Now you got Los Angeles reimposing the mask mandate. Now they got people who are mad at them because they're saying, even if you've taken the vaccine, wear your mask. And we had a scientist from North Carolina A&T on who kept trying to explain to people that that the COVID vaccine is not 100% proof. That just because you get the vaccine does not mean you can't get COVID again. It drastically reduces the possibility. And if you do get it, it's not going to be as fatal as it was as it was last year, but we're seeing an increasing number of people who have gotten it. Coco Gauff pulled out of the Olympics because she got COVID. Rich Eisen with the NFL Network vaccinated, he got it. Bill Maher, he got it. There was another media person the other day where, and they, again, all took the vaccine, but they still got it.
Right. I mean, the closest thing I can give to people is birth control pills, right? Women, we know we can take birth control pills, but if you go and you're not protected or you're not using other methods of trying to have contraception, you can still get pregnant. Same thing with COVID-19. The vaccine is supposed to allow your immune system to be ready on day 0 if you get in contact with someone with COVID. It does not prevent someone from coming into your presence, coughing in your face, and actually transmitting the virus to you. It's not the analogy I use is like a raincoat. I can have a raincoat on and keep me dry for the most part, but if I jump into a pool of water, I'm going to get wet. Same thing with this vaccine. You cannot rely on it to prevent you from getting infected. It is supposed to be a booster for your immune system to be able to respond. And a thing I think I said on the very first time I was on your show, we use death too much in America as a sign of how this pandemic is going. There are other consequences of COVID other than just death. The vaccine does a fantastic job of keeping you alive if you get infected with COVID, and that's fantastic. But what we do know is that long COVID does is this, and long COVID is where the inflammatory process of this virus literally causes your organs to work differently, your brain, your kidneys, your lungs. And so there's studies out of Stanford, for instance, where they looked at people who didn't present with brain like symptoms of loss of taste and smell. They didn't have that. But when they did autopsies on these people after they died from COVID, their brains resembled those of persons with Alzheimer's and Parkinson's disease. We don't know what this virus is doing as far as the impact it has on your body structurally. And there was a report by Fair Health of over 2 million people. And what they found was that 23% of those 2 million people complained of symptoms of COVID-19 for at least greater than 30 days. And that's what they were using as a marker for long COVID. And the interesting thing was that 19% of people who said, I didn't have any signs and symptoms of COVID. I didn't have a cough. I didn't have a fever. I literally just went and got tested and I came up positive for COVID. Well, 19% of those persons like that said that within those 30 days, something about their body was different. Either they complained of GI upset, they complained of what we call COVID brain fog, or inability to concentrate. They had painful experiences. They had differences in their lab work. And those are people who didn't even have any signs and symptoms that they were infected in the first place. So to play around with COVID when we don't know the long-term impact it can have on your body is a dangerous game to play.
And then, I've got fools on YouTube going, oh, this is a con game. This is a joke. The vaccine is a joke. And I'm sorry, it is not a get out of jail free card where, oh, I can now just go out and wild and out and I can just walk around. And part of this thing was, this is where the information came in, Ebony, and where it was problematic because then it was like, oh, well, no, sure, if you got vaccinated, you can be in groups now, and you can be in groups of, up to 10 and 20 and everything is fine. It was kind of like, yeah, but you don't know if they has got it.
Right. And we were saying that with the CDC's lifting of the mask mandate, we had to realize it was based on information that was coming out of Israel. And Israel did a fantastic job at vaccinating their country. They literally had 60% of all their adults vaccinated by April the 3rd or 4th, I think it was. But they still didn't lift their last mask mandate until April the 18th to allow for even more persons to be vaccinated. Now, we in the United States of America, we still have not gotten to 60% of our population fully vaccinated, and we know that. And so for us to try to use Israel as a surrogate for what we should do here was premature, in my opinion, for one. For two, we know that we have to think about COVID on the global scale of things and then also locally. So to tell the entire nation, United States of America, hey, you can go about your lives and take off your mask and wander about, when we're having outbreaks in Missouri where people are literally have to transport their patients out of state because they don't have any hospital beds for them. We have outbreaks in Mississippi, Florida, literally 1 in every 5 new cases of COVID is coming out of Florida. Stay away from Florida. When we have those types of situations, we can't make these blanketed statements and say, go out and be free when it's not safe. And vaccines, for those persons saying that vaccines don't work, what I'm telling you, in my ICU right now, I have a person half my age, literally. If they don't get a lung transplant, they will die. That's the truth of what happens. It's not old people. It's not the sick people. It is people that look just like you and me that are struggling to breathe at this point. And it doesn't have to be that way. The vaccine does a fantastic job of preventing you from getting to that severe form of COVID-19.
Look, one of my lawyers was misdiagnosed. Absolutely believes that she has COVID. Doctor said, you have COVID lungs. 3 months ago, she said, I need to transfer your work to someone else because I am still dealing with COVID 1 year later. And I texted her the other day just to see how she was doing, and she's getting better, but this is a year later. And these people are playing games. You tweeted this, a friend who got vaccinated, I think she's a doctor if I'm correct, and got COVID. There's so many other examples. I saw a tweet the other day where a young lady out of Houston, she's a pharmacist, and her dumbass boyfriend refused to take the vaccine. Now his ass is in the hospital, in the ICU, fighting for his life because he was like, oh yeah, that vaccine is stupid. We see these other stories where people were big time anti-vaxxers, and now they're literally fighting for their lives, and they're posting these photos of them in their hospital beds. And I don't understand how nuts folks are on this. I don't get it. I don't get it. I'm not trying to play games. I'm not trying to be sick. And again, bitching about a mask. Like, first of all, Ebony, here's what's so crazy.
Yeah.
It's not that many times I'm actually around a lot of people. So when I walk into a convenience store, mask. Now, when I'm walking out and ain't nobody on my left and ain't nobody on my right or in front of me, behind me, hell, I take it off.
Right.
I'm trying to figure out why is it so hard.
It's hard because people want to make it hard. People will complain about the wetness of water if you let them. But what I do know is that those same persons who are complaining about a mask, when they come into the hospital, they are begging for a mask that has some oxygen because they can't breathe. And I think what we have to realize is the burden that it placed on medical professionals. You mentioned the retweet I did of a physician who is now infected because trying to take care of persons who have COVID in the hospital. That's one of my greatest fears. I mean, I go to work and I will go to work and take care of patients because that's what we're supposed to do, but I don't want to die. And so for persons to be as selfish as they are to say, I just don't want this, right? If you have curiosities and you have concerns about how the vaccine works, for sure, let's talk that through. But if it's just I just don't feel like doing that, then if COVID touches your throat and you cannot breathe anymore, think about if you're going to keep that same energy. Because if you're not going to keep that same energy and you're going to want someone to help you, then help me help you. Go get vaccinated. You can text your zip code to GetVax, which is GETVAX, and it'll have all the information of exactly where within your locality you can go and get vaccinated. If you have questions, find me on Twitter. Write me, and I'll try to answer as many of your questions as possible. But what we know is that right now, the persons that are dying in the hospital aren't the very old, because we've done a great job of vaccinating our elderly population. Over 70-80% of those elderly people are vaccinated. It's young people, and they're leaving behind their kids. They're leaving behind orphans at this point. You don't have to do that. You literally can get a vaccination, save your life, and hopefully, if we are to get infected, if I do get infected, hopefully the vaccine will prevent me from getting long COVID and a permanent disability related to this virus. So, yeah.
Look, I got this fool here. Y'all are just mad because we won't run off the cliff with the rest of the sheep. Okay, Silver Harmonics, well, when you die of COVID, let us know. Your family.
I pray he doesn't die.
No. See, sometimes you got to go ahead. So, Silver Harmonics, if any of your family members are watching, if you die of COVID, let us know, because you were stupid with the comments you made on YouTube. Then I got this person, Blessing Season. So you trust the government. What about the Tuskegee experiment? Okay, let me say this
Can I talk on that for a second? Can I talk on the Tuskegee?
Go ahead. Because I was going to go ahead and handle it, but go right ahead.
Because Tuskegee is brought up over and over again, but if people truly know the history of what Tuskegee actually was, Tuskegee experiment was carried out from 1932 to 1972, just 10 years before I was born. It was actually ended. And this Tuskegee experiment was actually the U.S. Public Health Service calling out to the Black community saying, we want people with quote unquote bad blood to come in and we're going to give you treatment for bad blood. But actually what they were looking for was people with syphilis. And the thing with Tuskegee was that they did not give them treatment. That was the problem with Tuskegee. They
Hold on. Let's slow that down. They were not injected with anything.
No.
What they did was monitor them. They didn't give them any. They didn't provide any medical care. There was no injection of Black people to the Tuskegee experiment. Go ahead.
Right. And that's the problem. We knew that the cure for syphilis in 1940 was penicillin. So for 30 years, they allowed this experiment to happen, knowing they had a medicine that could cure these people. And so with COVID, when we've been watching for this last year and a half, Black and brown people dying at higher rates, if the United States government said, we have this vaccine that could save your life, and they said, we're not going to give it to you, that would be Tuskegee Part 2. But what we have now, this whole idea of, I don't want the vaccine because they may be trying to do something. Do you think I would go and tell my grandmother to do this? Do you think you would see that the most powerful people in our country were the very first ones running up on stage to try to get vaccinated because they realized this is the only thing that could keep them alive to see 2022. We've already lost 630,000 Americans at least, and that number is grossly underestimated because we weren't testing a lot of people early on in the pandemic because we didn't have tests. So when we're looking at that, it's again, whenever you're trying to come up with an argument, and I welcome healthy discussions, but make sure it's based in facts. And if you're going to bring up Tuskegee, just realize that Tuskegee was the holding back of medicine. It wasn't the giving of medicine. They knew we were sick and they said, I'm not going to treat you because I want to see what syphilis does to the brain, to the lungs. What does it do to someone if we don't give you medical care? Well, you don't have to have that anymore in America. You can get treatment, and that starts, especially in this pandemic, with, again, texting GetVax, GETVAX, your zip code, and you can find out where to get vaccinated.
All right then, Dr. Ebony Hilton, and I see your nice little cute candles over there over your left shoulder.
I got to zen out. This has been a stressful week. I'm tired.
Yeah, no, you trying to get your little 10 for 10 on Room Raider on Twitter. You ain't fooling me.
It's a candle from Rewind, and actually that's a great company.
I mean, you got the books, you got the candles, you got your 18 degrees on the wall.
This is not office.
Only thing missing is your little.
You give everybody else this kind of grief.
Yes.
I ain't seen it.
I give you extra grief.
I'm gonna give you extra grief.
I ain't seen it. Okay, Charleston.
I haven't seen it. But I'm gonna take a peek.
All right, we'll chat later.
All right, I'll see y'all.
All right, take care. All right, y'all.
Folks, back to our Roland Martin Unfiltered video in just 1 moment.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.
And first of all, her state is last when it comes to folks getting vaccinated. They were so adamant when it came to a mask mandate. These idiots in Alabama voted for Donald Trump. They followed his stupidity, his refusal to put a mask on. He himself got COVID. Now we know, based upon a couple of books that have come out, Donald Trump was close to dying as a result. And if it wasn't for them throwing everything, using every life-saving measure, he would be dead due to COVID. And here is Kay Ivey saying enough is enough.
Clear about this issue, and media, I want you to start reporting the facts. The new cases in COVID are because of unvaccinated folks. Almost 100% of the new hospitalizations are with unvaccinated folks, and the deaths are certainly occurring with unvaccinated folks. These folks are choosing a horrible lifestyle of self-inflicted pain. Y'all, we've got to get folks to take the shot. The vaccine is the greatest weapon we have to fight COVID. There's no question about that. The data proves it. I've taken the shot back in December, both shots. And it's just the thing to do. So the unvaccinated is who we need to focus on. Y'all get them to start taking the shot. It's their job to take care of themselves and us as well. We can't do that for them. All we can do is everybody take the shot themselves. So encourage others to do likewise.
And just one quick question to follow up on that. What would it take for you to implement a mask mandate?
I want folks to get vaccinated. That's the cure. That prevents everything. Why we want to mess around with just temporary stuff? We don't need to encourage people to just go halfway with curing this disease. Let's get it done, and we know what it takes to get it done. Let's get a shot in your arm. And so I've done it, and it's safe, it's effective, the data proves that it works. It doesn't cost you anything. It saves lives.
Governor, and that's
students who are too young to be vaccinated and are returning to school in a few weeks, are you recommending for them to wear masks in class?
That's left up to every school in the district to make that decision.
All right, we've got time for one final question.
Governor, you talk about, the vaccine saving lives, but Alabama still is last in the country when it comes to vaccination rates. Besides, this emotional plea you just gave us, what is it going to take to get people to get shots in arms?
I don't know. You tell me. Folks supposed to have common sense. But it's time to start blaming the unvaccinated folks, not the regular folks. It's the unvaccinated folks that are letting us down.
Well, Tyson, if she had talked that tough a year ago and that frank a year ago, probably Alabama wouldn't be in the position.
That was exactly my thought. I really would have appreciated hearing some of this a year ago and early in the vaccine rollout campaign. So I was with her up until the point where she talked about what to do about it right now, because vaccines are effective. They are very effective at preventing severe COVID-19, but you cannot vaccinate yourself out of a surge. That's because the vaccines work very well, but they train your immune system to work. And that takes up to 4 weeks for the Johnson & Johnson, and it can take even longer for the mRNA vaccines. So you are not going to shut down a surge in your state with vaccinations alone. Eventually it'll work, but people will die. So what you have to do are public health mitigation measures. These are mask mandates at the minimum, and then think about capacity constraints in businesses and establishments and things like that to really break the chain of transmission, because the people who are infected today are infecting the people of tomorrow right now. So you have to do something right now. So vaccination is certainly a part of it, but right now they need to think about what to do about breaking the chain of transmission right now. And I think the message fell off for me right at that point.
Folks, back to our Roland Martin Unfiltered video in just one moment.
Racial injustice is a scourge on this nation, and the Black community has felt it for generations. We have an obligation to do something about it. Whether it's canceling student debt, increasing the minimum wage, or investing in Black-owned businesses. The Black community deserves so much better. I'm Nina Turner, and I'm running for Congress to do something about it.
You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible.
4 million people worldwide have died of COVID-19. Folks, that is a devastating number. The cases, 186,618,097. Here in the United States, 34,677,918 reported cases and 622,235 deaths. Now, last week we told you about the Delta variant that is spreading rapidly and becoming the new dominant strain in the United States. Experts are saying another new variant, the Lambda variant, has already spread to 29 countries, including the United States, and is circulating heavily in South America. In North Africa, only 4% of Tunisia's citizens are vaccinated, which is twice the average across the continent. Countries are struggling with vaccination efforts due to a lack of accessibility. In Haiti, they're about to roll out their vaccination programs. Of course, they now have serious problems there because of the assassination of their president. Now, while other countries face the difficulties of the pandemic, the CDC is saying vaccinated teachers and students no longer need to wear masks inside school buildings. The CDC's new announcement follows a decline in COVID-19 hospitalizations across the nation and a national campaign making children as young as 12 years old eligible for the various vaccinations. Dr. Joseph Graves, Jr., professor of biological science at North Carolina A&T, joins us right now. Doc, glad to have you here. When we talked to you last year about COVID-19, you said there are going to be different strains. That was, I think it was March or April. We now are seeing that. The issue that we're now dealing with is the vaccinations that have been created. Can they counter these new strains?
Well, right now, the good news is that they can, but we don't know how long that's going to be true. So the problem that I've been consistently pointing out to as many people as I possibly can is that evolution works and the virus evolves. And currently, while the vaccines do protect against both infection and also, most importantly, hospitalization and death, there's no guarantee that that's going to continue to happen. And let me give you a really concrete example of this. In 1917, the influenza then acted very much like COVID does now in terms of mainly killing old people or people with pre-existing conditions. But after 1 year of evolution in the human species, by 1918, the 1918 variant killed across all age categories. And eventually the pandemic lasted 5 years and killed over 100 million people worldwide. And so my fear is that we're just beginning to see what COVID can do. And so the idea that people are falsely presenting is that we're somehow out of the woods is absolutely incorrect.
And the thing here is, you have these states that rush to open up. You have folks who are unwilling to take the vaccination. You've got conservatives who say, look, I'd rather die than take these vaccinations. You got people who are still acting a fool, upset with masks. And I'm sitting here going, y'all act like everything is all hunky-dory and all good. It's not. We've had Dr. Ebony Hilton, who's been on the show. She said a friend of hers who was vaccinated actually got COVID. Other people have talked about that as well, them having the vaccination and still getting COVID. So you still got to take precautions.
Yeah, absolutely correct. I mean, in the best of cases, the vaccines prevent infection of the Delta variant at 79% Moderna and 64% for Pfizer. But that means that 21% and 36% of people will catch the Delta variant even if they're infected.
All right, so hold on. I want you to repeat that. If you had the Moderna shot, I've had that one. What's the percentage?
The percentage is 21% can still catch COVID even if you've had the Moderna shot, and that's basically 1 in 5.
Pfizer.
And the Pfizer is 64%, which means 36% can catch COVID, and that's basically 1/3.
J&J.
I don't know what the numbers are for J&J yet, so I can't speak to that. But it's most unlikely, I would say very likely it's in the same range as Moderna and Pfizer. And so the point here is that right now, even though the vaccines protect you from catching COVID, it's still preventing people from being seriously hospitalized or dying. But we don't know how long that's going to last. And here's the problem that I've consistently tried to warn people. The larger the number of people are who are not vaccinated, the larger the opportunity is for the virus to evolve more transmissible and more dangerous strains. And that's why when I spoke with you back in March of 2020, I argued that it was really important for us to drive down the number of people infected, not just in the United States, but worldwide. There needs to be an international effort to get vaccines out and to bring down the number of people infected as soon as possible. If we fail to do this, and unfortunately we are failing to do this, we are going to see more and more and more dangerous strains. And so far, we haven't seen a 1918 influenza that kills everybody. But I hate to say it, and I hate it when I'm right, but if it continues on this path, I will say we will definitely see a more dangerous variant coming along in the not too distant future.
And this is also why, we've made this point that you've got to have the federal government putting the resources and I keep saying it, putting it in Black-owned media, putting it in other forms to communicate to people the right information. And it doesn't help when you have these assholes at Fox News and OAN and Newsmax who are constantly out here fighting vaccinations, fighting masks, saying it's time to stop wearing masks on buses and trains and airplanes. And I'm like, are you idiot? Do you fools realize what's actually going on?
Yeah, and you're absolutely right, Roland, because quite frankly, reports have demonstrated that if the federal government had acted in a concerted manner in January of 2020, we could have prevented now some 500,000 deaths, or close to 500,000 deaths. So I lay all those deaths at the doorstep of Donald Trump and the people in the Republican Party and in the right-wing conservative media that enabled his crazy messages to go to the public. These people are irresponsibly killing people that did not have to die.
So somebody's listening to us right now, African Americans listening, and they're like, hey, doc, I don't care. I'm just not going to take this vaccine. Basically, what you're doing is you're playing Russian roulette with your life. The reality is you can very well die. If you take the vaccine, what you're saying is even if you get the Delta strain, you're not going to be as in bad of a shape as folks who do not have the vaccine.
Correct. Vaccination will still save lives with the Delta variant. And quite frankly, this comes down to not just a question of saving your own life, but saving the lives of the people you love. And I have to believe that people still do love other people besides themselves. And so, the longer we go with people not vaccinated, the more we are essentially, using the word Russian roulette, or rolling the dice towards an apocalyptic pandemic. Now, again, I characterize COVID right now as a level 3. But this non-vaccination, this anti-vaccine campaign is driving us in the direction of a level 4 and a level 5. And we have an opportunity now to stop this. And if we don't, future generations are going to look at this foolishness, and that's if we have future generations, which are not at all guaranteed if we keep this nonsense up. But they're going to look back at the foolishness of this generation, and we will be held account.
Dr. Joseph Graves, professor of biological sciences at North Carolina A&T University. We certainly appreciate it. Thanks a lot.
Thank you, Roland.
Folks, back to our Roland Mark Unfiltered video in just one moment.
Racial injustice is a scourge on this nation, and the Black community has felt it for generations. We have an obligation to do something about it. Whether it's canceling student debt, increasing the minimum wage, or investing in Black-owned businesses, the Black community deserves so much better. I'm Nina Turner, and I'm running for Congress to do something about it.
We got to deal also with these people who are just saying all kind of silly stuff. Homegirl of mine out of Atlanta, Shanae Hall, she posted the interview that I did with Dr. Ebony Hilton, and we talked about the Tuskegee experiment. And then all these folks who were jumping on her page, who were weighing in, and people like, whoa, well, you know, y'all making a big deal out of this. And then one woman was like, you know, I was able to keep my family straight by having them take vitamins and stuff along those lines, and then you know, stop trying to force this down our throat and all sort of things along those lines. One person said, oh, it's all about, if all you got to do is just keep your immune system strong, and that's it. And then one person was even suggesting that when it came to the vaccine, well, forget a vaccine, we need a cure. And I'm going, you know, there are no cures to viruses. I mean, so just speak to that, the skepticism and the stuff that people throw out here when it comes to dealing with these issues.
It's a very important issue because we want to make sure that people are getting accurate and up-to-date information. And just to be clear, vitamins are good. I take vitamins. I think diet and exercise are good. I try to do those when I can. But when it comes to a global pandemic that has killed over 4 million people worldwide, that did not exist until the end of 2019, it's a whole other game. And we have to think about what are the ways that we can prevent this. And luckily, we do have vaccines right now that are very safe and very effective. And for people that were skeptical about the trials, we saw the trial data was fantastic. For those who want to wait even longer, we've had the rollout going now for several months, and we've seen the effect of vaccination. So the amount of people that are going to the hospital who have been fully vaccinated, very low, about 3% of hospitalizations. The people who are dying from COVID-19 who are fully vaccinated, 0.5% of deaths from COVID-19. So you can see the power of what vaccination can do. I do think that we have to work on decentralizing the message and making sure that it's getting into the community from people that you know, trust, and love. So your pastors, your community leaders, your own physicians. There's a poll I saw that suggested that a large percent of people who are unvaccinated have not actually had a conversation with their physician about it. So these are the kind of things that we need to do to make sure that we can combat misinformation, encourage people to get vaccinated, and just keep pushing the message. We can't stop because we have to get to this goal.
You know, and I just, you know, again, I look at, and then some of these people are going, well, one person posted, well, 99% of the people who got in COVID, they've survived. So you just want to ignore the 600,000 plus deaths. Okay.
4 million across the globe, 600,000 here. Those are certainly undercounts. You know, we can focus on that small percentage, but when we're talking about a large segment of the population being infected, that small percentage of deaths is going to translate to a lot of people who died needlessly. And I want to emphasize the point, these are unnecessary at this point. We can prevent this. You know, we were in a different situation last year and we were talking about mitigation measures, hoping for a vaccine. The vaccine is here. We need to get it in the arms. We need to make sure that people are protected, and we need to make sure that our children are protected. Remember, children below the age of 12, I've got two myself, they have no protection right now against an adult who might be in close contact with them, who's unvaccinated, who may not believe in public health mitigation measures. There is no protection for them right now. So we need to make sure we're doing everything that we can to combat this misinformation. And you know, whenever these numbers are put out, we just need to come hard and correct with facts and just reemphasize how significant this pandemic has been, the toll it's taken on our community, and the fact that vaccination is the only way out of this.
Folks, back to our Roland Mark Unfiltered video in just one moment.
Racial injustice is a scourge on this nation, and the Black community has felt it for generations. We have an obligation to do something about it. Whether it's canceling student debt, increasing the minimum wage, or investing in Black-owned businesses, the Black community deserves so much better. I'm Nina Turner, and I'm running for Congress to do something about it.
You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. The COVID-19 variant, folks, is causing problems all across the country. It is hitting red states extremely hard. You have governors like Alabama Governor Kay Ivey who is saying, throw their hands up saying, what do we do? Well, part of the problem is when you have these folks in these red states who have said they didn't want to get vaccinated. We're seeing more and more of these stories where people who refuse to get vaccinated and now they're sitting in hospital rooms and they're dying because they're hard-headed. Dr. Tyson Bell is an infectious disease expert, University of Virginia. He has joined us on many occasions before. And Dr. Bell, look, you and Dr. Ebony Hilton and so many others predicted this in dealing with these folks, and they're so hard-headed, and all of a sudden these people are going, oh my God, I'm dying. In fact, Clavon Bell, I'm going to show you folks this here. He posted something today. He's, of course, the doctor out of Arizona who's been posting various COVID updates, and that was his 34-year-old brother, prominent anti-vaxxer, had posted all kind of stuff, how he wasn't getting vaccinated. At one point, he said he had 99 problems. The vaccine wasn't one of them. He dead. 34 years old. He's dead. Stephen Harmon, that's him right there. No longer among the living, because he was adamant about not taking the vaccine.
Roland, thank you for having me on first off. And, this was one of these things that, I sure hope that I was wrong about this, but of course, the Delta variant, this is the most aggressive version of the virus that we've ever seen. In fact, Dr. Vasyl Walensky, director of the CDC, said that this is actually one of the most infectious respiratory viruses that we've ever seen, period. So when you have communities that have low rates of vaccination where people are still vulnerable, this is what you're going to see. And we have, in addition to Arizona, other areas of the country that have low rates of vaccination. You're seeing reports from hospitals that they're taking care of more COVID patients than they've ever had before, including last year, and opening up units again. So it's really sad to see. And what makes it so frustrating this time is that this is preventable. I work in the intensive care unit, which means that patients who come to me are critically ill, they're struggling to breathe, they're struggling for life. And we know for a fact that COVID-19 vaccines can prevent this. So it's a failure of messaging, failure of public health. There's an active misinformation campaign that I think is really contributing to this. And we really have to work hard to make sure that we can vaccinate people, correct the misinformation, and get vaccines into the community and convince folks that are on the fence to get vaccinated. And then think about mandates to get the rest of them because, we can't go through this again, Roland.
Folks, back to that Roland Martin Unfiltered video in just one moment.
Racial injustice is a scourge on this nation, and the Black community has felt it for generations. We have an obligation to do something about it. Whether it's canceling student debt, increasing the minimum wage, or investing in Black-owned businesses, the Black community deserves so much better. I'm Nina Turner, and I'm running for Congress to do something about it.